Hello, my name's Tino Rivera, and today I'm going to be talking about vaginal cancer. You guys will learn what vaginal cancer is, the types and stages, risk factors, symptoms, treatment and prevention, as well as incidence and prevalence among different ethnic and cultural groups in the U.S. So, what is vaginal cancer? Vaginal cancer is cancer that starts in the vagina, and the vagina is lined up by cells called squamous cells. Cancer starts when these cells begin to grow out of control. There's also different types of vaginal cancer as well as different stages. So, as for the types, there are four types. The first type is squamous cell carcinoma, and this type is common in the upper area of the vagina near the cervix, and 70% of vaginal cancers is squamous cell carcinoma. This type begins in squamous cells that make up the epithelial lining. Adenocarcinoma makes up 15% of vaginal cancers and begins in the gland cells, and this type develops in women over 50. Melanoma makes 9% of vaginal cancer and develops from pigment producing cells. Melanoma, in fact, occurs in the lower or outer portion of the vagina, whereas sarcoma occurs deep in the walls of the vagina. And sarcoma makes up 4% of vaginal cancers and begins in connective tissue. This type also develops in women over 50. Now, on to the stages of vaginal cancer. So, stage one, cancer grows in the vagina but is not spread further. So, in the pictures that are going to be shown, the cancer is represented by blue cells. So, as the stages increase, the spreading of the cells increase as well. In stage two, cancer spreads outside the vagina into surrounding tissue. Stage three, cancer has spread outside and has reached side walls of the pelvis. Cancer can also be found in the nearby lymph nodes at this stage. Stage 4, cancer has spread to other organs of the body. So stage 4 is split into two, 4A and 4B. In 4A, cancer has spread to bladder or rectum or any nearby organ. In 4B, cancer has spread to organs further away, such as the lungs. Now on to the risk factors. Risk factors include age, diethylstilbestrol, human papillomavirus, cervical cancer, smoking, drinking alcohol, and having HIV. So, squamous cell cancer occurs mainly in older women. Only 15% of cases are found in women under 40. Des was a hormonal drug given to women to prevent miscarriages between 1940 and 1970. These women eventually had daughters, which had higher chances of developing adenocarcinoma. Having cervical cancer also increased the chances of developing vaginal cancer. As for HPV, up to 9 out of 10 vaginal cancers are linked to HPV. And smoking is known to double a woman's risk. Alcohol and HIV also are known to increase these chances of developing the disease. Symptoms include unusual vaginal bleeding after intercourse or menopause, a lump or mass in the vagina, watery vaginal discharge, painful urination, frequent urination, back pain, constipation, pelvic pain, or a combination of all. For prevention and early detection, a female can delay first sexual encounter until late teens, avoid sexual intercourse with many partners, or avoid sexual intercourse with someone who has had many partners. Have protective sex, have regular pap smear tests, and quit smoking if they're regular smokers. As for treatment, there are a couple choices that people can have, just depends on what they feel more comfortable with. These choices include surgery, radiation therapy, chemotherapy, and complementary and alternative methods. As for incidence and prevalence, vaginal cancer is quite rare. In fact, only 1 in 1100 women are affected. There was a study between 1998 and 2003 that compared white, African American, Hispanic, Asian Pacific Islander, and non Hispanic women and their incident rates with vaginal cancer. The study showed that incidence of cervical cancer was in fact higher than that of vaginal cancer. The median age for a white woman to be diagnosed was 69. The median age for an Asian Pacific Islander was 63. Black women had a 72% chance higher than white women for getting vaginal cancer. As for Hispanics, they had a 38% chance higher than white women. Asian Pacific Islanders had a 34% chance lower. And that concludes my PowerPoint. I hope you guys learned as much as I did, and these are just references if you guys want to go and look up more information. Thank you.